You know, we're fortunate now to have two different PCSK9 inhibitors available for the treatment of patients with coronary disease who have not low low LDL cholesterols despite maximum statin therapy. And the ODYSSEY trial is patients who've had a recent acute coronary syndrome. What's really interesting, I think, is that when we do clinical trials, sometimes they get blanked at first event. And we don't actually ask the question, okay, what about reducing second, third, or fourth events? Which begins to get at this question, let's not just look for the first survival curve benefit, let's ask the question, what happens downstream? Do those curves really diverge? And they do. ODYSSEY shows that each year there's a reduction of first, second, third, fourth events compared to the max dose statin arm. It gets at the question of cumulative benefit, and especially like in younger patients, if you start imagining therapy for 10, 20, 30 years, you're talking about potentially a risk reduction that boggles our minds. And to me, that's a very exciting part of the ODYSSEY trial. The investigators chose very carefully to look at that cumulative effect, not just on the first event. Anytime we start dealing with therapies that are antibodies, monoclonal antibodies, we're dealing with a lot of cost to create them. And in a society that is feeling the tension already, it's difficult to deal with. The cost benefit or the value of these agents, if we show that over 5, 10 years, there's further reduction in death, hospitalizations, expensive items, then that changes the way we look at them, at least to some degree. Clearly we need lower price. We need more competition. We need these drugs to be available to a large number of people who currently can't get them. But it certainly gets to that question.